Hi, it's Dr. Wake Up here, speaking to you from a hospital in London. I picked the name Dr. Wake Up because it really resonates with me on a number of levels. I work as an anaesthetist, or an anesthesiologist as they say in America, and my job involves sending patients off to sleep for their operations and then waking them up at the end. And believe it or not, it's much harder to wake a patient up than it is to send them off to sleep. And I really do think this is a metaphor for life. It is much harder to get people to wake up to their problems than it is to get them to ignore them. I had my own wake-up call about 3 years ago, where I had been suffering from a number of health challenges. For years I'd been having problems with low energy, chronic exhaustion, and I had quite a low immune system where I'd get frequent colds and the flu. But on top of that, 3 years ago, I started to suffer with really severe insomnia. The irony isn't lost on me that I was an anaesthetist working, sending people off to sleep all day long, and I myself was really suffering and not able to sleep. At best, I was getting about 2 hours sleep a night, and this went on for months and months and months until it became unbearable, and I knew I had to do something about it. So my quest actually originally began with me looking for cures for insomnia, but it involved me having to face up to the fact that I had been ignoring a lot of issues and a lot of the problems that I was having. And on top of that, I was working in pre-assessment clinics. Now, in pre-assessment clinic, we're seeing patients that are coming in for operations, and we're trying to assess the level of risk that operation is likely to pose to them and the likely complications. And then we try and reduce those risks. And that's the idea that I became really fascinated by, the idea that we could modify risk, improve patient outcomes, and possibly reduce hospital stays. So I learned a lot from looking into that area. Believe it or not, in medicine, we spend a lot of time studying sickness and disease, but very little time studying health and health promotion and prevention of disease. And that's where my learning has come in the last 3 years. And I've got a message that I now want to share, because fast forward 3 years and I am now healthier than I have ever been in my life. I have more energy, I sleep really well, I have an amazing immune system, and I don't really get ill anymore. And these are all things that I have personally tried and learnt. And I think it's very important that you believe and trust the person that you take advice from. I would never take financial advice from someone who was in a worse financial situation than me. So why would you take health advice from someone you thought was in a worse health situation than you? And often as doctors, we don't set the best examples. We have very erratic lifestyles. We work long shifts, and often we don't have reliable access to food and being able to drink enough water and exercise and not drinking alcohol and smoking, and often we're overweight and suffering with chronic diseases. And then we sit in these clinics and we say to patients, this is what you need to do to improve your health. And I'm almost certain they're looking at us going, why should I believe you? Looking at you when you're not an example of what it should be. So I'm really trying to live the lifestyle that I'm promoting and recommending, so that you can see that it actually really works. It really does. So pay attention. There's a lot to learn. If you keep an eye on my Facebook page, I'll be posting lots of information. I also have a blog at www.drwakeup.com. And also sign up for my health clinic emails, where I'll be sending out regular emails with bits of health advice and tips. And they're all simple, easy things that you can do that can have a dramatic impact on your quality of life and health. So I'll speak to you soon. Take care.